any points of accuracy arising which you've not already let Jenny know? No. Are there any matters arising that are not on the actions list? No. Well, we will take those as a true record. Thank you very much. If we can move to item 4, which is the actions log and matters arising. Any questions or comments on that? It's fairly short. No, thank you very much. Well, I'm delighted to move to item 5, which is our staff survey presentation. And thank you very much to Jean, who was going to tell us a bit about her volunteering experience, but is going to do that at another meeting. We'll look forward to that, Jean. So thank you very much, because it's very timely that we bring this presentation to you and this information to you. So Steve, over to you.
Hi, thanks Sharon, and I'm sorry Jean if I've bounced you off the agenda, apologies for that. For those who don't know me, I'm Steve McGowan, I'm Director of Workforce and OD, and I've been with the Trust for just under 3 years now. So what I've got today is a presentation that kind of brings together the National Staff Survey results. I'll take you through a little bit of background about the survey, some response rates, some of the answers that we've got, and then some comparisons with other trusts about how we're scoring. Happy to pick up any questions at the end, or if you want to put things in the chat box, then that's absolutely fine. Pete Beckwith is just cast it onto the screen, so thanks for that, Pete. And Pete's going to kind of click through the slides as I talk. So just a bit of background for those that aren't aware of the National Staff Survey. So all provider NHS trusts complete it. Usually it's done on October, November time of the year, and then we get the results early the following year. Obviously, in 2020, this was done in a pandemic, which brought with it a number of challenges, and I'll cover some of that off in the results as well. So we have a choice to go to a sample of staff or all staff. For the last 3 years, we've gone out to all staff, so every person that works for the Trust has had an opportunity to complete the survey. And the questions are the same, whichever trust you work in, around about 111 questions, I think, and they are grouped across a number of themes. And again, I'll go into that in a little bit more detail. Usually 11 themes. There was 10 for last year because one of them was dropped because we were in a pandemic. As a trust, we give staff time to do this. We really encourage it. We push out. We want to get as many people responding as possible. We do everything we can to try and get a high response rate, and we build that kind of time into their working day to make sure that people can do it. We have moved to wholly doing this online now. Used to be done as a paper-based, but with everybody having access through ESR, we can send that out, and I'll cover off some of those response rates. And just when I talk about benchmarks, we're in a group with 52 other trusts. So that's other mental health, LD and community trusts that we look at our results and are able to sort of compare them. I think as well, you'll be aware that the results are really important, and we use the results to shape what we do going forward in coming years. So some of the things that you will have seen over the last 2 to 3 years, the PROUD programme, the investment in health and wellbeing, some of the investment in estate, these have come because of what staff were telling us through the survey, areas that we maybe needed to improve on or invest in. So really important for us, really is something that as a board we take seriously, look at the results and help sort of fit it into the work that we do going forward. It's not just the HR survey as well. So my colleagues also look at this. There's lots of data in here about how we deal with serious incidents, what our estate is like, our patient experience. So colleagues outside of HR also use this survey to shape the future. So Pete, if you want to just flip the next slide, if you may. So hopefully everyone can see that. So just looking at response rates then, and quite a few slides. So I will go through this relatively quickly, and as I say, I can send people can have access to the slides at the end or ask any questions. So response rate, we 43% compared to 40% the year before. So we were pleased with that we increased it, particularly as it was in a pandemic. You'll see from there that broadly we got some areas that respond very highly, the chief exec's area, workforce and OD and nursing and quality, some really high response rates in there. Some areas where we know getting those responses back in is a little bit more of a struggle, and that's something that managers work with. Managers get shared this information as well, and they get shared it as we're going along in this to try and encourage it. But we were very pleased to increase our response rate given what we were in last year compared to the year before. Pete, next slide. So we can break these results down in a number of different ways, but one of the areas we do is look at the different areas of work of our workforce to see where the responses are. So one area that jumps out there is our estates and auxiliary staff. That's something that I know Pete Beckwith is going to be looking at going forward. This may well be as a result of doing everything online. So we've got some work to make sure that that group are engaged and we get up that response rate next time. But broadly speaking, across there, the professional leads will look at this and then discuss in their respective groups on what the response rates are like and sort of comparing across the trust. Next one, Pete. Thanks. So this next slide, I mentioned that they talk about themes. So the themes are those that are listed there that we kind of are scored against. Now, what you see in front of you is the whole of the NHS in 2020 and how it came out with the survey. So overall, nationally, you will see that 3 of the scores increased, 1 went down, and 6 remained the same. So that was the picture taken for every trust, and the average of that across the whole of the country. If you click on Pete, next one, thank you. So with that in mind, this next slide shows our results. So every theme in our trust increased. So we kind of booked a national trend there in the sense that of all of every factor that was measured increased, and some of that was larger than others. Some of those increases, but we saw a positive response in all of those across that kind of 43%. And next slide, Pete, please. Thanks. And when we look within those themes, then the way that the survey is done scores it in what is considered an area of strength, an area for opportunity for improvement, and then an area that kind of needs to improve. And you'll see there that of the scores of the questions, we had 77 areas that were seen as a strength, with 32 as an opportunity to improve and 8 as a need to improve. And I've got a slide later on that kind of comes back to that. But just to give a bit of context to that, if we looked at last year, we were at sort of 69 areas of strength. The year before that, we were at 50. So we've kind of gone from 50 to 69 to 77 in the last three years. And you'll see that overall in those questions, of all the questions that were asked, 76 were considered to be a significant improvement. 33 was a no significant change, and only 2 were deteriorations, which again I'll cover later. And of those no significant changes, of those 33, actually 29 of those did increase. They just didn't increase to a significant amount. So a really positive set of results in 2020 compared to 2019 with regards to the direction of travel. Next one, please. But it's important that when we look at that, it's absolutely important to understand where we were and where we're going to, but also to then compare our results across our benchmark group. So what you have on this slide is those same theme scores, but for an average across the benchmark. And you'll see there that we've still got some work to do to get to the average, and obviously want to be better than average with our benchmark trusts. We've narrowed the gap in a number of areas, but we've still got some work to do to be able to take that forward. So we're now above average for 3, we're below for 6, and 1's the same. Again, 12 months ago, we'd have been at only 1 above average, 3 and 6 below. So, and we've really narrowed those differentials. So great improvement, going in the right direction. But I think there's nobody on the board or an exec team that would rest on our laurels and say we've got this cracked. We know there's still work to do, and that's part of the plans that we're putting in place and these results and how we use these results. I guess the other thing for me on this slide was just those response rates as well. So, we are even at 43%, which was great compared to 40. Our benchmark average is at 49. So some work to do still to kind of get that message out. But hopefully you can see there a real sort of a trajectory that is going in the right direction. and I can pick up in more detail now just some of those sort of questions, just to highlight the kind of things that we ask our staff and how we look at those results. Pete, next one. So two really key questions that are in the survey that are used by CQC and in a number of different formats are: would you recommend the organisation as a place to work, and would you recommend the organisation to have treatment? And as you can see in both of those questions, we saw our answers improved over last year, with still some work to do, but obviously quite a big increase in the recommend as a place to work, and an increase likewise in the recommend as a place to have treatment. Next one, Pete. So look, I believe there's lots of reasons to celebrate in these, but I'll just go through some of the most positive scores that we've had, and then look at some of the areas that we still need that kind of continued focus on. So if we just go to the next one, here's a sample of 3 questions that are kind of around the area of equalities and discrimination. So as you will see, for some of those questions that ask, have you experienced discrimination at work, either from your manager or from patients, we are above average in our scores, and that's in a positive way. So the answers that we're getting, we're amongst the best that are out there with regards to our comparator trusts in these particular questions, which again, when we think of the investment that we've put in, when we look at some of the groups that we've set up with our under the equality and diversity group and some of the staff network groups, that's really powerful for us to see that coming through. Next one, Pete. So again, a number of you will have heard me talk about the investment that was needed in our managers to help them be the best that we could be. That's what our staff were telling us, and staff governors have told us that actually how we manage people, how we lead people could be better. So we embarked on 2 leadership programs as part of the Proud work. We started to roll that out, and we put quite a significant investment in it. So it's great to see that some of that's coming through in our survey results. So positive results around support from my immediate manager, getting feedback and asking opinions and how we do it, all more positive last year than what we'd seen in the year before. Next one, Pete. And likewise, one of the areas of questions that one of the themes within there is, are you thinking of leaving the organisation? Or do you look for a new job? And again, we've seen a more positive response in that. Still work to do, but a more positive response in that in this last survey. Speak. So it's really important to us around the wellbeing question, and there's again a positive answer there about coming into work when, despite not being well enough to do, again a real improvement in that in the score, and also some two questions there around opportunities to show initiative and improve that kind of teamwork. Again, all 3 of those have shown big improvements in 2020 from 2019. Thanks, Pete. And then just finally on the things that I think are really worth celebrating, the questions around wellbeing. So again, we know that was an area we wanted to improve. We know, again, we've invested in that, and we've put some groups together. We have a staff wellbeing group that's chaired by Lynn Parkinson. We've got staff governors, we have the trade unions on that group as well. So we've done a number of initiatives through that, and it's good to see that starting to come through now in our staff survey results. So staff believe in the organisation it's taking a positive impact, and that managers are doing that as well. So really good to see, and really important to see that that's working its way through to how staff feel to work for the organisation. So we've called this an area of continued focus, and some of this will be actually some of the things that we've just spoken about. So next one, please, Pete. So look, we've done really well on wellbeing. We're going in the right direction, but we're still below average on that when we compare ourselves. We know we've got some work to do about musculoskeletal from what our staff tell us, and some concerns around patient service users. So these are areas that are more positive, musculoskeletal are accepting, but still kind of work to do. Just on the MSK issue, so we've as a result, a part of this kind of feedback, we started a fast track physio service for staff, which went live on the 1st of March. I know that we've had a number of staff that have accessed that already. So again, listening and looking at this survey results, listening to our staff, we've started to put some things in that hopefully will address that moving forward. It's Pete. So again, this is the manager's one, so positive, but still shows the work that we've still got to do. We're still below average on a number of areas around immediate managers supporting staff around that wellbeing and encouraging staff. So going in the right direction, but we've got to keep that focus up. We've got to keep developing and investing in our managers and our staff so that they continue to give the best support to staff, particularly when you look at what we've been through in a pandemic in the last 12 months, and as we get into this recovery stage, both from a recovery of performance, but allowing staff to recover from what they've been through. Thanks, Pete. And then finally, so Hilary and her team have done some fantastic work about how we deal with incidents and how we treat staff and how we report those incidents, and you can see positive results within it, but again, some of that's still below average for us, so we know we've still got work to do to get that where we want to be. Thanks, Pete. So I mentioned earlier on in the survey that those kind of our lowest scoring, the below 40%, the must improve. So as an exec team, we set ourselves a challenge to shift performance around that. Obviously, the pandemic hitting made that even more of a challenge, but it's really pleasing to see that in 2019 we had 12 areas that we were below 40. We're now down to 8, and of those 12, 11 actually increased. So there was only one score that went the wrong way for us, and that was that place to go for rest and recreation at work. And again, we've got some plans around how we're investing in our estate, investing in canteen facilities and rest areas, and Pete Beckwith's leading that to kind of roll that out over the next 12 months. So we'd really hope to see some shift in performance around it. But in every other area, again, it's going in the right direction. So we are not where we want to be yet in those. There's still 8 areas that are below, but all going in the right direction, and a reduction down from 12. Thanks, Pete. So when we look at it, when we look at the surveys and we kind of come together, and as an exec team, we look at the things that we want to focus on. And I guess what the survey told us was we were on the right lines with the things that we've got in place. And some of it's about continuing to do the things that we've already been doing with maybe with a renewed impetus now that we're through, as we get through the pandemic, should I say. So recruiting more staff, the resetting of establishments. We know that we've still got more vacancies than we want. We've increased our headcount even during this period over the last 12 months, but getting more staff, filling those vacancies, allowing our staff to take breaks as a result of that is really critical to our improvement and to the recovery agenda. We know that the staff survey results we make the biggest shift when they're looked at a local level. So directorates get all of their individual results broken down, and they work on their plans to put things in place to support for their staff. So that started over the last 2 years, which really got some momentum. The Workforce and OD Committee get presentations from each department area on what they're doing and have done through the year. We need to continue doing that. We need to keep doing that shift. I've talked about leaders and managers and that continued investment. That's really important, and also the estate and staff. And to kind of bring this to the conclusion then, that improvement in the health and wellbeing offer for our staff, to continue doing what we're doing, to give staff the opportunity to recover so that we don't lose staff from the organisation when we get through this pandemic, is really important for us. And that's absolutely a focus of the work that we're going to do over the next 12 months. So, Pete, I think that brings my presentation to a conclusion. Happy to take any questions.
Thanks ever so much for that really good presentation, Steve, and thanks, Pete, for being a bit of a whiz on the slides, because they're very efficient. So well done to you as well. So really good news, and we will absolutely take questions, but I just want to say, in all the time I've been on the board, this is the best set of staff survey results by a mile. Things have been absolutely improving over a number of years, but it's a real achievement and something to be really celebrated. Steve's right. It's, you know, it's not where we want to be in every respect, and still more to do. But it's a testament to the hard work and commitment that's gone in, that this demonstrates directly the effect it's had. So, I suppose, a really big well done from me and the board on these results, because it is fantastic, and to all of you, all the exec team and all the staff, for everything they've done. So I think we've got a couple of hands up. So if I go to Gwen first, please.
Yeah, I think you asked us to introduce ourselves. I am Gwen Lunn. I'm a councillor and the Hull City Council's nominated governor to this board. I think the figures are reassuring and they give us something to look forward to, but I would like to see if there could be an analysis on how long they've been in the organisation, to see how those views either strengthen or weaken or change even. I don't know if that's a viable thing, that you have enough hours in your day to do that, Steve, but I would be interested in seeing that.
God, I think it's a really good point. We do get that data. We get breakdown by the age range. So anyone who completes it does that, and their length of service. So that is a level that we can dive into. As you already pick out, it can be a bit of a rabbit hole when you get into this. And I've got some of my team that love doing it. So that is something we can look at, and I'm happy to bring something back at a later date around that. No problem at all.
That would be lovely, for the simple reason that it allows us to see how their experience of working for the trust changes, if it changes over time. So thank you.
Yeah, and I think it's a really important point, isn't it, with regards to that kind of retention and ensuring that we meet our staff. So, for example, we've got so next week we've got a catch up with the exec. So anybody that started in the last 6 months for this trust has a call like this. I'm actually leading the one next week, and we talk to our staff and say, so how's it been in your first 6 months? How are you finding it? Just because often getting in early to try and sort some issues, if there are any issues, is the difference between us hopefully keeping those people and changing it and losing it. So we put sort of things in place, but analysing the data, as you suggested, is another way. So happy to do that.
Thank you.
Right. Really good idea, Gwen, and we'll take it as an action just to bring an update on that point, Steve, if that's okay. And hopefully by the next Council of Governors meeting, if that's all right, Steve, 3 months' time. Is that okay? Thank you. Any other comments, Fiona?
Yeah, hi, Steve. Oh, well, actually, good afternoon, Nigel, because I don't know where you are, but I'm Fiona Sanders. I'm one of the public governors for the East Riding of Yorkshire. Yeah, what I was going to ask, Steve, is that given that staff are given time to complete the survey, and 43% is a good increase, how are you getting those staff who appear to be reluctant to complete it on board?
Yeah, it's a really good question, and to some extent, it's going to be down to how we need to target those areas that haven't done. So as you can see, some areas are in the high 90s. So I think we have to be cognizant that we've been in a pandemic, and for some people, just to do this was maybe a task that just passed them by in what they'd been in at that time. What we are saying to managers really is make sure you give that protected time, and we hold managers to account on those response rates. So when we're in the open window, we get response rates on a weekly basis. We will use that back to the managers and ask them what they're doing to try and shift that performance in those areas. You know, I've got to say, from Michelle's leadership, it's very clear on vodcasts that we give people the time, and if people aren't getting the time, all they need to do is talk to us. So I hope that we've kind of got that message across corporately. Maybe what we need to do is within some of the more as it rolls down into the hierarchy, I guess, is to try and make sure that we push that and get that kind of take up. Ultimately, it is an anonymous survey, though, so you know we are driven to some extent by, you know, we can lead that horse to water, but what makes it drink slightly more difficult.
Yeah, I can appreciate that. And is it part of the Proud programme then? Is that something that is encouraged and sort of explained in great detail as to how it can improve, you know, things within the organisation?
Yeah, I think so, Fiona. It's kind of one of those things, isn't it, where you have to you kind of have to get through the cycle a year or two to be able to show some of the things. And it's kind of, I guess it's that, what did the Romans ever do for us? If we can show that, we've invested in the estate, we can show that we've got leadership programs, we can show that we've put money into wellbeing initiatives. We start to build that up by saying, look, we really do listen, and these are the things that we've done. So that kind of reinforcing of that message and the communication around that is something that we try and do. That gets stronger every year because we do more every year, frankly. I think the more we do that, will give people confidence to say, do you know what, it is worth doing because actually it does make a difference. And I guess that's what we want to get to, really.
Yeah, that's the message, isn't it, that needs to be out there. Oh, well, thanks for that anyway, Steve. Thank you.
Thanks, Fiona. Really good points. And Steve's right, and you can see it in the trust, the difference and the ownership of it. So this is not something that comes to the board and sits in a drawer. It's actually now used and owned by teams. And I think Lynn's on the call, but Lynn chairs, as Steve said, the Staff Health and Wellbeing Board, and they use this data, and they were avidly waiting for it to be unembargoed so that they could use it, because I attended their meeting. So it really is used and looked at, isn't it, Lynn? And it's become real now for the staff about what they can do, and they're owning the data as well. So I think Steve's right. I think there's been a real cultural shift, that it's not just some national survey that doesn't matter, and what's the point? The point is it can make real change. So I think that's been really encouraging to see that. And I'm just looking at that. So I've got Francis next.
Thank you, Sharon. And I'm Francis Patton, Nigel, one of the non-executive directors. And I was just going to say, and Dean might want to pick up on this, we also have, and Steve can as well, we also have regular presentations at the Workforce Committee from different bits of the organisation, talking about what they've done from a staff survey position, which have been really interesting and have really raised the profile and shared with us what each of the directorates have been doing about it. And that was very useful and very helpful.
Thanks, Francis. Tom?
Hi, yeah, so Tom Nicklin, Staff Governor. I may or may not be able to sort of answer this question, but for example, with the staff surveys in the areas where you're getting sort of really sort of positive feedback from staff, do you tend to sort of notice, or is there any links to then getting that positive feedback from the friends and family testing in the same areas, sort of reflecting obviously where our staff obviously are really happy and content, is also where our patients are happy and obviously really content as well?
That's a great point, Tom. Steve?
Yeah, it is a great point, a great question, Tom. So do we see some correlation? Yes, I think we do. And in the accountability reviews that Lynn chairs, we look at staff survey results and we look at overall performance and particularly that survey. So I do think you see a correlation between that, Tom. Absolutely, those higher level of engagement and the more positive scores start to come through. There's many factors, as we know, that feed into that, but you certainly do see that kind of linkage in, definitely.
Yeah, that's the hope of it, isn't it? You sort of want to see that sort of link, don't you? Really, ideally. But yeah, it's really positive. Thank you.
Yeah, and I know Mandy's on the call. So Mandy also uses this data to sort of work alongside the kind of patient experience feedback and feed that in as well. Because one of the things that we do find is maybe the more, so dare I say it, my sort of area, Pete's sort of area, the corporate areas, maybe some of the scores around the kind of patient experience aren't as strong in that area, and some of that might just be down to not understanding. So Pete and I have got some plans about how we're going to address that over the next sort of 12 months, of bringing our staff together to understand the patient experience a little bit more, to try and shift that kind of performance. So that's a real tangible of using that data to say, what do we need to do to shift it in those maybe more corporate areas that don't see the patients on a day-to-day basis.
Thanks, Steve. We've got quite a few hands, so I'll take them in order. So I've got Michelle first.
Yeah, no, thanks, Seth. Good afternoon, everybody. It's a great report. We have made steady progress over the last 4 years, because just to remind people, when I arrived in the organisation, we were bottom of the league table for everything. So it is absolutely really positive, and we'll continue to develop that journey, because as Steve says, there's still quite a lot of work to go. Just picking up Tom's point, really, I think for me it's about, and there is a real lot of research that says happy staff equal better care for patients and higher quality and safety, etc. Lots of work by Michael West, etc., that clearly demonstrate that. But for me, it's important to take this as part of a dashboard and a suite of information around friends and family, length of stay, performance, sickness, absence, etc., because it all starts to really paint a really important picture. But I always, also utilise this as a really good recruitment tool as well, because a couple of things that staff look at when they're changing organisation is one, CQC findings and report and narrative, and secondly, it's what staff are saying. So it's really vitally important. And it is really, really positive. Lots more work to do, and we'll continue to do that. And we do hold people to account, but it is a collective. We're in it together. It's also about, the Council of Governors and the people on the Council of Governors. So I thank all our community as well. But let's keep going and let's keep at it. But some really great questions. But triangulation, Tom, and everybody, is so important that we do utilise this, not just in isolation from other things. It is important, but we utilise it in that triangulated process to give us that really overall picture of our organisation.
Thanks, Michelle. And I think Dean's put something in the chat box, actually, building on Tom's points. Thank you for that, Dean. Hugh?
Just building on those points, really, the governor group that looks at workforce quality and mental health act legislation may be a really good point to really good place in the autumn to pick up on what progress is being made across the quality linked to the workforce agenda. So it also comes with a plea that we need somebody to chair that quality workforce group as well. So just a plea in that. But I think that, the other thing is, I lived in this part of the world for many years and dealt with community services and mental health services and this, and it is great to see such an improvement in the overall scores on the doors in terms of this survey. So well done to everybody involved.
Thanks, Hugh. And I'm loving the pitch for a chair. I'm working on it. And so thank you for that. Mandy?
Yes, it was just really to reiterate what Steve had said around the staff survey and patient and carer experience. On the back of last year's survey results, we reached out to corporate services to ensure that they were fully informed on the patient and carer experience agenda at team level. And we asked corporate services to identify a staff champion of patient experience, as well as our clinical services. And I was invited to a number of corporate services workshops. Business development springs to mind as one, where we did a Slido session on how can we involve patients, carers, service users in our work in business development. That's just one example. And they identified that when negotiating, going for new business, tenders, that kind of thing, let's bring lived experience in the room to help us when we're actually, negotiating, writing tenders, etc. So it really does make a difference when we keep everybody informed at team level, no matter what department or section of the trust you work in. So, we found these results really valuable to help us to see the progress there. Thank you.
Thanks, Mandy. That's really helpful. Dean?
Yeah, it's just responding to Hugh's point and the important point about the links, I think, between workforce and quality that we not only see through the staff survey, but Mike might also want to add, but I sit on the quality committee as the workforce chair, and Mike sits on the workforce committee, which I chair, and we often identify sort of areas of linkage between. So we've seen, for example, presentations at the quality committee on having technicians, pharmacy technicians based upon wards, which is sort of new ways of working through the workforce, and the work we do on equality, diversity and inclusion with our staff also translates to the way people access services, health inequalities. So there are some really good links, and I think it'd be a good idea, Hugh, to pick it up in there, and we can increasingly show those links, I think.
Thanks, Dean. So Jenny will take that as an action, please, for the next governor group that focuses on quality workforce and mental health legislation. And Dean, if you can work with Steve and Mike Cook on that, and possibly one of the execs lead quality, that would be really good. But we'll put it down for an action for Dean, please, if that's all right, Jenny. Steve?
So I guess it was just one other point from around the response rates. So I know for my director, I foolishly said if we reached 80%, then I'd end up buying some prizes for a bit of a raffle, and we did do that. So it ended up costing me a few quid, but we managed to get it up there. So I know there was a question earlier about how you get your response rates out. So whether my colleagues need to take up that challenge, or maybe I'll throw that one down.
Thanks, Steve. And I think Anne already put something in the chat box. Yeah, the executive directors get very competitive about their own directorates, about where they are on the league table with their staff completing the staff survey. So it does cause a bit of amusement at the board when we get the updates. So no, well done. Is there anything else before we move on? I think that's been a really good discussion, really good presentation. So thank you again for that. And obviously we've got the follow-up action agreed from that as well. So really, really good result, and more to do, absolutely, but really is a well done to everybody. So if you could please move on to item 6, which is my chair's report. It's, well, time flies, 3 months since our last meeting. It's been a really busy time as always. So external meetings, I've continued to meet and play my part in the various regional and local ICS meetings. So met with lots of fellow peers from Humber, Coast and Vale, the integrated care system, and I'm also the representative for the Trust on the Humber Advisory Board. So as the governors are very well aware, the integrated care system is moving along swiftly with the proposed new legislation. And just to remind you on that subject, we have got a date in the diary for the 23rd of April for another session on the integrated care system. So I know it can seem a bit complex and it can seem quite fast moving, but we have got that session in the diary. So for those of you who'd like to come and hear more about that, you know, Katie will reissue that date. I think it's on the calendar anyway. Continue to meet with the Yorkshire chairs and lots of local chairs as well of our partners to encourage joint working and new ways of working. So the chairs of Care Plus, Navigo, Yorkshire Ambulance Service, HUS, NLAG and others. I've also had a meeting with the regional director, which was really good, very positive about the trust. It's also been my pleasure internally to attend quite a few of the PACE, the Patient and Care Experience Forums. Great to hear from patients and carers direct. So I've been lucky enough to attend quite a few in the last 3 months actually. And I know Mandy's always looking to build on those and take those forward. I am the staff wellbeing champion. It's a new role that's still been sort of details coming out about what's expected from that. It's part of the promises of the people plan, the NHS people plan. So Dean has kindly agreed to be my deputy for that. And part of that, I have started attending the Staff Health and Wellbeing Board, which Lynn chairs, which we mentioned earlier. And I have to, and a few of the staff governors, actually, Jack and Anne, you're on that, they're on the call. Really vibrant and committed, enthusiastic group of staff from all different areas and all geographic areas coming together to really own and take a lead on staff health and wellbeing. It's been really encouraging to see the changes they need to make, and they've just agreed their priorities for the next year, which is really good. And they are their priorities, which is really encouraging to see. And I'm sure that some of that will be picked up later in the meeting. Michelle and I have continued to do our virtual staff awards to meet with people who are either retiring or have got long service or are employees of the month. We're having to do that virtually still, but Kerry very kindly on our behalf sends them out a muffin and a drink and some tea so that we can all have tea and coffee together as we meet virtually. And as I say, not quite the same as meeting in person, but we feel it's really important that we keep acknowledging the contribution that our staff are making. I would also like to mention the Easter virtual service that our chaplain, Eve, did organise, which was a really nice service. As some of you know, and I know some of you do attend them, Eve does them for all sorts of things. So we've done Pride, we've done all sorts of different events, and they're very inclusive, and it's great to see some patients and volunteers joining those. In terms of the governors themselves, I've seen quite a lot of you over the last few months. The very active group, and I thank you all for your contributions. You are volunteers and we are grateful for the time that you give. I've continued with my regular meetings with Sam, our lead governor. I've also had meetings with the public governors, and we talked about that earlier. And I've also met individually with quite a few of the new governors. as they settle into their roles. And as I say, we have also, since the last meeting, had 2 really good sessions, one on the mental health pathway, which included a bit on the mental health redesign, and also more recently, a really good session on community services and the pathway for our patients through that. So I think I'll stop there. I could go on. Are there any questions before I move on? No, thank you very much. Well, with that, we'll move on to item 7, the Chief Executive's report. Michelle.
Good afternoon, everybody. I'm not going to take you through it as normal. You've all had a chance to have a look at it. I'll pick out some highlights and then we can have a conversation. Lots of the things happening around the organisation. There's a full COVID report later, so I won't dwell on that too much. Just to say that we have circulated now all our flu vaccination certificates to everybody that was a peer vaccinator, and our figures, again, as I think I've been reporting all the way through, have continued to improve year on year. I think it started at something like 34% over 4 years, so they've now gone up to 79%, so that's great. And we've also started to circulate some thank you certificates and cards and badges to everybody that's involved in the COVID vaccination programme as well, but there'll be more on that in my next report. We continue to support and say thank you to staff who are our greatest asset, and it's great that we've had that really good presentation from Steve in relationship to the staff survey. We've allocated an extra annual leave day to all our members of staff. To be taken on or around their birthday as a thank you, but also it's important that that is taken on or around their birthday, because that's a bit about their friends and family, and hopefully as the restrictions ease they can get a little bit more of that contact, and also that's part of our recovery plan. So that's something that we will continue to monitor as well, so that's happened. One of the other things I would draw your attention to, if you've not had a look at it, please have a look at our anniversary video. If it's seems a long time ago, no March, but it isn't. When the pandemic was declared, we've done a little video just to some positivity really, and some bit of a journey about how much everybody has actually been through over the last 12 months. So please have a look at that. And we are just about to relaunch our book that we published last year, which was those stories of positivity, and Together We Can. So that was relaunched as well, and we'll continue to update that and launch it. We are selling a few copies as well. It's not quite in the Sunday Times bestseller list yet, but we're working on that as we speak, and it has gone out to a lot of media outlets. It was absolutely fantastic for the communication team, particularly as well as the organisation, to get the recognition on our website. Again, it's something that we've been actively looking at about accessibility. So it's great to be in the top 5 in the country really, and I really do compliment the team themselves, and specifically I'm going to embarrass him, particularly Adam, who's probably on the call at some point somewhere this afternoon, because we did all that in-house. And that is even more impressive. So again, I thank them. I thank Mandy, particularly for the youth board. We've now set up a youth board, which I have the honour of opening and attending, and I'll continue to do that. That's going to be a great forum for really getting feedback from our young people. So thanks for Mandy for that. And as with everything Mandy does, it was full of passion and enthusiasm, and it'll be a real influencing committee and board. So I really look forward to seeing that develop over the next months and years to come. We've extended the Shiny Minds contract. Again, that's part of our recovery plan. It is part of our COVID. It's an app that supports staff. It's got reflective practice sessions in. It's got meditation. It's got a button for people to say thank you to each other. So we've extended that contract, and the app is being used by our staff. So that's great. And if you remember, we were a bit of a pilot site for the golden button, which is sending wider thanks out to individual staff. I'll draw your attention to the Humber Preceptorship Academy. And it was great earlier on this week to speak to a couple of people who have been through the Preceptorship Academy. So that's really, really good. Social values, our social values report, something that is very dear to my heart and others, which is about our work, but in terms of social values. That report came out in September. We're doing a whole week of publication on that because it's the start of the new year, our new financial year. There is a piece of work going on about accommodation at HQ, and we'll touch a bit on this when we get back to about COVID. It's about the blended approach going forward. we've made it really clear to staff all the way through that we've come so far. It's not going to look the same as it was last March. So there'll be a blended approach to people working from offices. So we're doing a piece of work at the moment around what HQ should or shouldn't look like, and where we can think about going with that. And staff have been very receptive, and we're leaving that to directors as well. So that's really positive. Lots and lots on the communication for you to have a look at. Lots of positive media. Obviously, we still get our challenges through, but there's lots of positive media stories as well, which is really important. Again, it's great for staff morale to keep those positivity stories going. The team do lots on awareness days, and I'll draw your attention to Mental Health Awareness Week that's coming up in May. More on this, we're doing a big brief on that. We'll make sure the governors get cited on that. And again, there's a health stars report with the Whitby, and I thank DOF and others for all the work that they're doing on Whitby. And just a bit of a heads up for the NHS Big Tea Party. We are looking at a celebration type event. We've just put a bit of a survey monkey out to staff to say what would they like in relationship to we usually have an annual staff award ceremony. We didn't last year for obvious reasons. And we're thinking we probably just need to change that a little bit, given where we're at in the pandemic. So more on that later. I'm not going to do too much this time on the integrated care system, because as the chair says, there is a session next week on that, which I'll go through it in quite a lot of detail. But suffice to say that the legislation starts to go through Parliament in May. This is to make the integrated care system a statutory body. Nothing really affecting foundation trusts as yet in that particular part of the legislation, but obviously it will change the landscape. So it will be quite interesting for people to dip into that session. I'm still actively involved in working through what that governance looks like going forward, and I'm still leading the 2 pieces of work around the Mental Health and Learning Disability Collaborative, and we're just working through the annual plan and the allocations. And I'm also now leading a bigger piece of work on what provider collaboration looks like, because part of the Act that's going through Parliament generates provider collaboratives. And that's about providers working closer together to stop tendering processes. So what should that look like in our particular system? I'm going to pause for breath there, Chair. There's a lot there. There's a lot in the report. I thank my colleagues for contributing to the report as well. There's a lot happening, but I'll stop and draw breath. We'll pick up COVID questions later because there is a full paper on that. But if there's any questions, I'm happy to answer them now.
Thank you, Michelle. As you say, loads going on, really a lot positive stuff. Just before I just move to questions, so Jenny, we will send round the Mental Health Awareness Week brief when that's all finalised, to make sure governors are in the loop about that. I think we've already sent it, but we'll send round a link to the anniversary video if we could as well. Jenny, please get Katie to do that. And just picking up on the social values, we are proposing to do some social values training for governors. This is an initiative of John Byrne, the medical director, at the June Governor Development Day. So I know Dean and Francis are involved as non-execs, but we are hoping to do some training for the non-execs. So I too will look forward to that, but that's going to be at the June Development Day. So Hugh?
Pick on the social value element first, because I think it's fantastic that the organisation is looking outward towards that social value piece, and I look forward to being involved in whatever way I can on that. The other thing is to congratulate everybody on the work on the youth board. I've been banging on about involving young people for a long time, and it's fantastic to actually see a structure and a process now evolving in order to do that. So thanks, Mandy, and thanks to the other people for doing that. And I know that from discussions with Mandy, it's very much more about a board that young people are leading and driving, as opposed to a Humber Teaching Foundation Trust youth board, because that it's a major thing to allow the young people to drive it and structure it. So that's great. Just being a pedant for a change, somebody needs to understand at 4.4.7, when they put the Nye Bevan programme in, I'm a Welshman, but also I'm very proud of the NHS and who founded and who led the NHS, and his surname isn't spelt like that. And it's really, it's trivial, but it's actually important that we're an NHS organisation and we can't even spell our own founder's name. The final bit for me is just in Pete's bit on the corporate accommodation. There's a fantastic book on the Medici effect, which is about in accommodation, making sure there are spaces whereby people can come together and share and create and be innovative. So it isn't just about office space. It isn't just about meeting space. It's about how can we create an environment where people can interact, socialize, come together and share ideas. There's loads and loads of research on what happened in the police and other places when they shut down canteens and the like, and what the impact was on different things. And the other part about that is making sure that the link we make with corporate accommodation, with the MSK wellbeing survey and the point that Jackie made on the chat, to make sure that when we're looking at changing people's working environment and them working at home, we also have that workforce assessment in place and well structured. Thank you.
Thank you. Some really good points there, and we'd just like to make sure you've read the papers, Hugh. You know that, so well spotted. So thank you for that.
Makes a change, doesn't it?
No, it doesn't. You always do. We wouldn't expect anything less, Hugh. We wouldn't expect anything less. Doff?
I've got two points I want to make. One of them is about Whitby and saying that there has been a huge amount of work going on in Whitby, and I think once we hear the results of the fundraising committee and our plans for moving forward, that's really exciting, and I think it would be great if we could share some of that maybe at a development session. But my second point was about the blended approach that Michelle referred to. And I didn't introduce myself to Nigel at the start of my contribution. Nigel, I'm the Whitby representative on the Humber board, so I'm the elected Whitby representative. And as you can imagine, it's quite a challenge for me to actually travel to all the meetings. And it has really been great that I've been able to attend a lot of meetings virtually. And so in the blended approach, I'm really, really keen that attention should be paid to ensuring that meetings can allow for virtual attenders. That's all I have to say. Thank you.
I think that's a really good point, actually, and you know, one of the things that staff are saying that anyway, Doff. I mean, a lot of staff are really content and happy. We know we've seen that from the positive staff survey, but really happy with the approach that they've had. It was difficult to start off with, especially when they were, you know, had children were at home as well. And I think that will get easier as there's more interaction and more social interaction generally as the restrictions are removed and reduced. One of the things the blended approach does is to look at, we're just debating how many, what we say that the majority of our meetings will continue to probably be on Microsoft Teams, or even a bit of both, because staff are saying it's the transport time, gives them more time, gives them more accessibility. And actually, when you look at the staff survey results and when you look at what staff are saying, they're saying that they see more of the manager, they see more of the colleagues, because they can dip into meetings, whereas before they found it more difficult to do that because of the travel. And we've also got to look at it from a green perspective as well. So it's a really good point. So that's what we mean about the blended approach. And we're having a conversation about council governors and board committees and board as we speak. So we'll come and consult with you about that in due course. But it's a really good point. Can I just raise a couple of things I maybe should have mentioned? One obviously is about the musculoskeletal service. It was remiss of me not to mention that. It is in the report, but this also came out of what staff are saying, and also reflects some of the things in the staff survey about having quick access to musculoskeletal services. So we've put extra money in that to provide some more services for that, and that's really positive. So I thank everybody involved in that, and just the work of our apprenticeships. We've made some real great strides on developing and growing our own staff and apprenticeship policy as well. So I think it's really important that we note those two. So sorry, Chair, I perhaps should have mentioned them when I was doing the overview, but I'll just draw the attention to those as well.
Thank you, Michelle. Thanks, Doff. Yeah, good. And Doff, I think it's probably a good suggestion. So Peyton or Steve, it's probably Steve actually, could we just have a brief update to the, I was thinking the June Development Day, Doff, would that be okay, on the Whitby fundraising? because the governor's followed with interest the CAMS Inspire fundraising, so it'd be quite nice to follow the Whitby fundraising, because I mean the hospital will be well on the go by then, won't it be nearly finished? So if that's okay, we'll take that as an action. And Steve, probably as the lead on charitable funds, if you could work with us to just make sure that we can give an update to that meeting, that would be really helpful. Is that okay, Steve? Yeah, thumbs up, that's fantastic. And Duff, we certainly don't want to lose you attending more meetings, so we will have to ensure that you can come virtually, absolutely. It's been lovely to see more of you during the pandemic. Is there anything else on that before we move on? No, lovely, thank you very much. If we can move on to item 8, which is the Council of Governors Effectiveness Review. This has got me down as chair to do it, but I have to thank Michelle Hughes for her help in drafting this and putting it together. For those of you who've been on the council for more than a year, you will recall that every year, as we do at the board, we do the same at the Council of Governors. We go through a formal process of reviewing attendance, the effectiveness, whether we've done what we needed to do of the council and the committees. We have only got 2 on the agenda today, so we've got one for the Council of Governors and we've got one for the Engaging with Members group. It is proposed that the other 2 groups will come to the next meeting, which is fine because it'll be sort of just July after the end of the year. So we're also asked each year to review and agree a terms of reference for all the groups and the council. So I'm not going to go through the paper because it's quite long, you've all got it. Are there any questions on the paper? Any comments on what's there? No? Are we happy to approve it and approve the terms of reference which are attached? Yes, any dissensions? No, okay, thank you very much. We'll say they're duly approved. If we can move on to item 9, which is the Public Trust Board meeting minutes for November, January and February. And again, I'll just take any questions if there are any. No, thank you very much. If we could move on then to item 10, which is the COVID update. And Lynn, if you just want to introduce yourself for Nigel's benefit, Lynn, that'd be really helpful. Thank you.
Yes, thank you, Chair. So I'm Lynn Parkinson. I'm the Deputy Chief Executive and Chief Operating Officer. So good to meet you, Nigel. So those of you who have previously seen this report, it's a monthly report that goes to board. Just to pull out a few highlights from it, as you can see, positive news overall in terms of COVID. The NHS national alert level was reduced in March from its highest level of 4 to 3. And obviously that was due to the improving position, particularly around admissions to acute hospitals, reduction in the death rates, and obviously the improving position around infection rates. And indeed, the infection rates that I've reported in the paper there have subsequently improved further as well. So that's great. Obviously, that still means that we are currently, given the alert level 3, still in emergency planning arrangements. So we still have our command arrangements in place, meeting regularly. We are in the process of reviewing those right now, given that the pressures related to COVID specifically are reducing. So there'll be a proposal that we'll be taking to our Gold Command next week, just to have a look at what we do going forward with those. The report, however, does obviously also demonstrate that despite the improvement in the COVID position, we are seeing some pressure still across some of our service areas, and primarily now due to the indirect impact of COVID rather than the direct, because you can see our sickness absence figures are significantly improved. So that's great, and obviously that's not causing pressures on our services overall. But what we are seeing, as we anticipated, is that increased demand, particularly for mental health services. We are seeing that, unfortunately, sort of through our crisis mental health services particularly, and some demand for our inpatient beds. So really paying close attention to that right now, doing everything we can to mitigate those pressures and manage as well as we we can. The other areas that the paper sort of points towards are our community services, interestingly, particularly in Scarborough and Rydale. And I think that's the ongoing impact of the work that we've done right through the pandemic, but particularly to ensure that we are supporting people to either prevent admissions to the acute trust or indeed to support timely discharge. And I think it's fair to say that that pathway that now has been introduced into that area has actually been really successful, a lot of which in terms of change of practice we want to maintain and keep. So again, no surprise really that those demands are still quite high in that area. The other area, perhaps not quite in the paper, but obviously is emerging as well, is increased demand for primary care. Primary care have obviously been undertaking the vaccination programme, but also obviously we knew there was some suppressed demand through the pandemic period. So again, our GP practices are busy right now. Since the report as well, obviously we have commenced now and nearly completed our programme of vaccination for our staff and our colleagues in other health and social care settings. So that programme will end after this current weekend. In terms of uptake, we're continuing to see really positive position in relation to that, so that's great. As we've touched on in the conversations already today, particularly around the staff survey, Sharon, you've already mentioned it a few times around the staff health, wellbeing and engagement agenda. That's been key to us anyway, broadly, but obviously given the impact of COVID in relation to our staff. And I think what we're focusing on now, Michelle's already mentioned it too, is we've provided, I think, a really good offer to our staff to date. But actually what we're focusing on now, and I think it's that sort of difference between the pandemic is abating. Our staff are in a position, obviously, where they've lived, they've worked through that for the last year. And I think as staff begin to sort of process the overall impact on them, and I think Michelle mentioned as well, sort of the trauma-informed approach to that. Our staff have variously experienced that impact. And now what we need to make sure is over the coming months that we've really got a robust plan in place that meets that need. We really want to make sure our staff are well, healthy, at work, and that we retain them too. So, that's, as Michelle and others have said, is really the focus right now. We're engaging with staff about that through the staff health and wellbeing group, but also more broadly to make sure that we've got the right approach and plan to support that. So that's very much the sort of next steps. Pete will be able to tell you a little bit more, but obviously we're in the sort of planning round now for the coming year, having finally got the planning guidance, really thinking again about what that means in terms of sort of our workforce and our sort of activity, of which continuing to recover services obviously from the pandemic is key too. So we expect to see some of that increased demand, particularly across our mental health services, particularly children's and young people services for some while yet. So children's and young people we've touched on already today, but again, that's an area that we're seeing increased demand for, particularly in eating disorders, interestingly, but particularly again for sort of that crisis inpatient support. We're working very closely with our system partners around what we can do more so around that, and obviously across our ICS too. So I'll stop there. But if there are any questions, happy to pick those up.
Thanks, and comprehensive report as always. And just in terms of next week's Development Day agenda has gone out, and when you get a chance to look at it, you'll see that there's a slot on there with a conversation discussion with our medical director John Byrne and our director of nursing Hilary Gledhill. So John said he's quite happy to pick up any questions on vaccinations or anything next week as well, if anybody would like to know more about that. So I'll go first to Mike Cook, please.
Good afternoon, I'm Mike Cook, Non-Exec Director, and in this context I chair the Quality Committee. And just to say, I think Lynn's reports from her, but also John Byrne as medical director and Hilary Gladhill as nurse director and allied health professions have been excellent. And it came right from the start with Michelle saying, let's be clear about this, let's try and get ahead of this. And whilst it's been tragic for a lot of people and their families, I think the things like the vaccination response, the staff engagement, the visibility of the leadership team, us all working together and partnering collaboratively have been real successes for Humber. And I just wanted to say that because I think this has been a very difficult long haul to try and handle. And I know there are concerns about staff recovery and how we go about this, but certainly the staff I talk to are very pleased that they feel valued and safe, as well as being able to keep patients safe. And now, as restrictions are lifted, to remain that way. So it's a big well done, and the Quality Committee commended this for the full board, these reports, because they gave a lot of assurance. Thank you.
Thanks, Mike. Really helpful. Are there any other questions? No, there's a lot there. We've sent out, Michelle and I have obviously been doing our regular updates to governors on the situation with COVID in the trust. We've sent out today, another one today, we're suggesting that after today we just stand them down for now because the situation's abating and not much changes in a sense on that sense. But obviously, if anything changes, we can reflect that. And obviously, the Council of Governors will continue to get updates through the Council of Governors anyway. So thank you very much for that. So if we could move on then to item 11, which is the performance report. Pete?
Yeah, so thank you, Sharon. So usual report performance to the end of February. Yeah, a few indicators that fall outside of normal variation, which there's detail in the report. I mean, obviously, one of the areas that we often focus on in here is cash, and we have seen cash improve again in the month. And a couple of reasons for that, really. One is we are hosting some funding on behalf of the ICS that we distributed, so there's a timing difference between when it comes into us and gets played out to partners. And we have had some success in reducing or clearing some aged debtors. And let's not forget, we still have an additional month block payment in our cash position at the end of February. As well as that, there's some commentary on safer staffing within the body of the report and a separate appendix on waiting lists. And rather than me read the key points of that, I think it'd be far more efficient if I were to stop there and ask for questions.
Thanks, Pete. We'll take questions. Any questions from anybody on the performance report? No? Okay. We will, yes, Francis?
Sorry, just similar to the comment Mike made about quality, I think that we should compliment the whole team on what they've done in terms of the financial performance of the trust and the way it's been managed. I think they've done an excellent job in very difficult circumstances. I know Pete's going to do a training session next week on the finances and where we are and take people through it in a bit more detail. But as chair of the Finance and Fit Committee, that I've been really impressed over the year how the whole team have really worked together to ensure that as a trust we've delivered a positive year-end result. I think it's a really good piece of work from everybody. Thanks,
Francis. That's really good. And you're down as a double act with Pete, Francis, just so you're aware. So we're expecting. I
am aware of that, Sharon. I am aware of that.
So just for Governor's benefit, we're doing a session also next week on the finances, and Francis and Pete are going to start in easy to understand language to explain it all to you. So that this was a bit of a request for new governors as well, particularly. So we shall look forward to that. It looks like a really good session. So thank you for that. Hugh?
You're on mute, Hugh.
Pleasantly quiet for a change. Just to echo what Francis said in terms of the finance report, I was going to bring it up in Pete's later paper on finance, but we had a meeting of the finance governor group a couple of weeks ago with audit. It was really good to see both audit and finance performance looking really good. So thanks to all the teams on that. Thanks to all the clinical teams as well for the overall performance. I think that the ongoing challenge for me as a governor, unsurprisingly, is the waiting time position, the waiting list size position, and to again look as planning guidance came out, and I know that it's out there, hits the streets. I've read it as avidly as ever I would have done when I was employed, but it is looking forward to saying what are the profiles going to be within our organisation, because as we know from the reports on COVID and the effect on COVID, cities like Hull have been affected horrendously by the COVID outbreak in terms of inequalities, in terms of kids and the rest of it. So it's not really a comment to tackle today, but I think that sooner rather than later as governors, we need to be starting to understand what is being put in place to tackle what friends and colleagues and around where I live say, as a public governor, what's going on in waiting lists. And it's difficult. It is very difficult. I said this to Sharon the other day, yesterday. It's really difficult as a public governor to say, there's money in the bank, we can't spend it, waiting lists are rising. It's a difficult sell.
Yeah, you raised it at the last Council of Governors, Hugh, and obviously we took as an action that Pete would start that discussion with the governors, and apologies for the misunderstanding about the governor group last week, but I know that Pete's intending to take that action and start those discussions, aren't you, Pete, next week at the Development Day?
Yeah,
absolutely, Sharon. We'll focus on how we've improved our cash position and the rationale behind that, because there is a story to that. And as Hugh will be fully aware that we operate on an accruals basis, but we'll go into full detail on that next week and why having the cash in the bank, you can't just necessarily draw that out and spend it. But we'll cover that in full detail next week.
I love the fact that we can't necessarily do that.
Yeah, let's save it for the discussion, Hugh. But yeah, you raised it last month, and as I say, apologies, there was a misunderstanding. But fortunately, the governor development session next week, we can start those conversations as agreed. Michelle.
Yeah, I am going to say this, and Pete is going to kick me under the table because it's not often I say this. It's a good job I've not got the medical director on the table, but it's not about money from a waiting list point of view. It's a whole multitude of factors and complexity factors, and it's obviously a trust issue, it's a local issue, it's a regional issue, and it's a national issue. And certainly I'm leading a big piece of work in Humber, Coast and Vale about specifically children and young people, which obviously is the bulk of our waiting list, to see how we can operate better across the patch. In the main, it's to do with capacity, but a lot of it's to do with recruitment. So at the moment, the challenge and also the interrelationships between the local authority as well. That's not a portioning blow at all. It's about how we maximise and support the local authorities in relationship to particularly looked after system. And it might be that we need to move some money around the system. We are getting more money in for children and young people from an allocation point of view, but we need creative solutions. So the challenge I've put into both the system and to Humber is for that creative solution to what is an ongoing issue, because it isn't just about the usual approach to waiting lists. We need to do something in a completely different way and quite a radical way. So it will mean about taking some risks as well. So watch your space on that, but you make a really good point, and it is something that the exec team constantly talk about, as do the board. And we have gone through the quality processes, and the quality committee are very supportive and also very challenging as well in relationship to the quality aspect. So I think we do look at it from a multitude of ways, but we do need creative solutions to it rather than just the old well, we'll do a waiting list initiative and we'll put loads of money in and we'll try and get staff. It needs to be something a lot more different to that.
Thanks, Michelle. That's really helpful. Paul?
Yeah, thanks. I probably build on what Michelle said, and I realise we touched on this conversation in some depth at the last meeting. I suppose my question, probably not for a response, Michelle, is given what you said and how Lynn reported back that some of those elements are out of her span of control. Is it time to revise the upper control limits? Is it time to revise those performance threshold targets if some of that is still out of our control once we've looked at some of the creative solutions? probably not looking for an answer on that one.
Okay, noted. I don't think this is about control limits. I think it is about the other creative solutions and how we move. I think you're right, Paul. It's about how we move some of the money, not necessarily for the organisation. This is the work I'm doing with my other hat on, but how we move some of that money around the system a bit more creatively, and hopefully the development of the ICS, hopefully the development of the work I'm doing with the provider collaboratives will allow that to happen. But we'll see. But good question, Paul, and I'm happy to pick you up offline.
Thanks, Paul. I do think it's really encouraging that the Michelle, as I say, with her ICS hat on, and colleagues at the ICS are looking at this, because it isn't one solution for one organisation, it's much bigger than that. So I think that's much more likely to have a creative solution, as Michelle says, rather than just a sort of temporary idea or a temporary thing that won't work. So very encouraging. Anything else on the performance report? No, thank you very much. Okay, I'm just moving on to item 12, the finance report. Pete.
Thank you, Sharon. So again, this is the finance report as at the end of February. I guess some of the key points I pull out of the report are that we are continuing, if I can even say it, to record a break-even position at the end of February for our operational finances. You know, on that basis, we remain on track to hit our control targets for the year. And I guess I'd pull out a couple of key points from the paper. We've already talked about cash, and as I've said, we'll cover that in detail next week. But our year-to-date COVID expenditure, including the top-up of income, total 13.2 million at the end of February. And again, I'll stop there, and I'm happy to take any questions on the paper.
Thank you, Pete. And presumably the Governor Group looked at some of the financial position, because Hugh's already reported a bit of that. So any questions for Pete on the paper? No, yes, Tim?
It's just a comment really to Pete, is that when you look at the income and expenditure summary, for the first time that I can remember for a while, maybe longer, the clinical services, you've actually spent a lot more in February, which hopefully will reduce the underspend on the clinical services. But it was good to see that perhaps this is as a result of what was said at the last meeting, when we were talking about further resources being put in and staff being employed. I don't know whether there's any comment on that.
I think it's a good point, Tim. I think it's a combination of the profiling of the budget, because obviously there was the CMHT pilot in there. You know, we have, you know, on that pilot more closer to full recruitment now than we were in the last report to the governors. So there's probably a combination of it, but you're right, operational expenditure, or expenditure on clinical services, has, I'm going to use the word accelerated, over the last 3 months from what has previously been reported.
No, thank you for that. Thanks, Tim. And yeah, CMHT is Community Mental Health Team, for those who are new to the Trust. And there's a transformation scheme about how that's going to look and its connection with primary care taking place. Well, it's been going on for a while now. Paul McCourt.
Apologies, couldn't get to the unmute button. Just a comment from me, really. I think, again, and I've said this before, congratulations to the team, really, to offer this level of sustainability going forward in such a dynamic and moving environment is real credit to some of the forward-thinking and progressive work that's been done. So I just wanted to flag that as a comment for minuting, really.
Thank you.
Thank you, Paul. And I do think so. I mean, I think, you know, there's always things that can be done better and improvement, and there are some areas of concern, but to maintain performance, both, you know, sort of clinically and financially in a year of a pandemic is, I think, a job, you know, well done to everybody who's tried to do that. It's been a very challenging year, so to achieve the that result at the end of the year is quite an achievement. So thank you, Pete. If we move on, we're staying with you, the annual declarations. And I know, Tim, thank you very much. You very helpfully sent Pete some comments in advance. So Pete, could you just perhaps pick those up as part of your introduction to this?
Yeah, of course, can. And before I do, Sharon, I've just realised I didn't introduce myself. So yeah, good afternoon, Nigel. My name is Pete Becker. You've probably gathered from now. I'm the Finance Director at the Trust. So in terms of the paper I'm presenting now, this is the annual declarations paper. And as a foundation trust, as part of our annual planning process, we're required to make some annual declarations. And there's broadly 4 declarations that we have to make. The first is that we're being compliant with our provider licence. The second is that we have met the required standards of governance. The third, and this is a relatively new one for the Trust, is that we expect to be able to continue to deliver Commissioner requested services or essential services. And the one that prompted that most recently was when we opened our CAMS Tier 4 unit, which is classified as an essential service. So we have to declare that we're able to continue to operate that beyond the end of the financial year. And the fourth statement we make is that we've equipped governors to fulfil their role. You know, within the body of the report, there's some evidence that shows how we can demonstrate our ability to make those declarations. And as part of our submission, we're also required to take on board the view of the governors, which is why the report is on today's agenda. Tim, as Sharon has just kindly highlighted, did drop me a note a couple of nights ago in terms of the report, and that was asking some questions on fit and proper persons test for governors. And I touched base with board support on that, and that paperwork will be coming out in the next couple of weeks to enable those declarations to be made. There was a question about being able to offer choice, and that was a really good question. And we maintain a directory of service, but that is to enable choice to be offered at the point of referral. So, you know, when a patient is referred into elective surgery or a choice is available, that's what our directory of service enables. And quite rightly, some of our services, there won't be an element of choice. You know, emergency services don't tend to do so. And the third one was just about including assets in our continuity of service evidence. So I gather there's quite a bit there, so I think I'll shut up and I'm happy to take any questions.
Thanks, Pete. And this is a paper that does come each year as part of our annual cycle of assurance, and it will be going to the board again after it's been here. Any questions for Pete? No. Are we governors happy to approve it? Any dissensions? No. Thank you. We'll say that's approved by the governors. Thanks, Pete. So if we could then move on, there's only a couple of items left. So I think if it's okay with the governors, we'll just carry on and finish the last few items. So we move to item 14, which is the engaging with members, governor group, terms of a governor group assurance report and terms of reference. Doff, did you, as the new chair of this group, who's sort of been launched straight into that task, would you like to say anything on this?
Yes, I'm very excited about being able to chair this group. I felt that the group has got a real lot of commitment and enthusiasm as a result of it. I mean, the report that you've got reviews our performance, but just picking up on the last item that Pete was reporting on, in terms of training governors, you'll be very happy to know that the Trust is supporting me to go on a training course about what is the expectation of all Trust members. So in trying to take forward this item, I'm also going on the training course supported by the Trust to do it. So I know there's a great deal of interest. We did actually talk about looking at ways to increase the amount of communication we have with members as a result of the survey that we undertook. And so we're exploring a whole number of ideas and looking to have an extra meeting. So although that may not be what the report said, I commend the report to you.
Thank you very much, Doff, and thank you very much for taking on the chair role. And I know that you're going to take a keen interest in the annual members meeting as well, aren't you, with the group as well? So thank you very much for that. So are there any questions on this report or the terms of reference? No. Are we happy to approve it? Oh, Michelle?
No, just to say thank you, Doff. This is such, as people know, this is such an important piece of work for the organisation. So I will wait for its development with interest, and thank you for taking that that offer up, Doff. I'm sure you do a great job, and I'm really great to hear that you're getting some training and support. But it is such a vital role for the governors and the organisation. So I'm looking forward to it developing.
Well, I'll try my best.
I'm absolutely sure, bless her. I caught you at a weak moment, Doff, didn't I, and twisted your arm. You'll be a fantastic chair of the committee. So thank you very much for that. So they're duly approved. So if we move on to item 15, which is the Governor Group's feedback and activity. And I think we've picked up on some of it already. Do any of the chairs want to say anything additional? Are we happy to just leave the paper as it is? No, any questions from anybody? No, thank you very much for the updates. And as Hugh says, we are looking still for a new chair of the sort of the half of the other governor group, the quality workforce and mental health legislation half, and I've spoken to one governor who might be interested, but if anybody is interested, please do let myself or Hugh know. We'd be very grateful. And if item 16, there aren't any points raised this month, this is just in case a governor raises an issue which we feel it would be helpful to report back to the full council. And then any other business? I don't think I know of any. Has anybody got any other business? No, thank you very much. Well, I think that's been some really good discussion and questions. So thank you all very much. Stay safe and look after yourselves. And I'm sure I'll be seeing you all soon. So thank you to exec and non-exec colleagues as well for joining us. So Adam, please, could you shortly stop recording? And thank you, last but not very much not least, to anybody who's joined us virtually. Take care, everybody.
Thanks, Sharon. Bye.
Thanks all. Thank you.
Thank you.